variants of femoral hernia. So this includes, there is the log femoral hernia. So this is nothing but through a gap in the and where is the gap present? It is in the lacunar, that is the Gimbernat ligament. And other thing is, it is always strangulated. Next, we look at the Neet's femoral hernia. So Neet's femoral hernia, it is seen in the patients with the congenital dislocation of the hip, and it is behind the femoral vessels. This is nothing but the Neet's femoral hernia. Next, we look at the Cloquet's hernia, and this is nothing but the sac lies under the pectineus fascia. Then we look at the Hasselbalch's hernia, and it lies lateral to the femoral hernia. Next, we look at the Serafini hernia. So Serafini hernia, it lies behind what? Behind the femoral vessels. Then we look at the Velpio, that is a prevascular, and the Thiel's hernia. So here it lies in front of the femoral vessels. So what was behind? The Serafini's hernia was behind. So this one is in front. Next, we look at the Beckelard's hernia. Beckelard's hernia is nothing but it is through the saphenous opening.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.